Hi, I'm Dr. Dan Shapiro. I'm plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of breast surgery. I do breast lifts, breast reductions, I do breast augmentations, and invariably, people are concerned about scars. Unfortunately, a lot of the surgery that I do will involve scars. And what I try to do is utilize surgical principles and technique to minimize the scarring and to make sure that those scars heal as inconspicuously as possible. A common question that I have is, Dr. Shapiro, if I need a breast reduction, how can I get a breast reduction and avoid all the scars? And uniformly, you cannot. Usually people that need a breast reduction have a lot of extra breast tissue and have extra skin. So that is generally not something that I can just do liposuction on, because the liposuction will not remove the glandular tissue. A lot of the macromastia or gynecomastia, that's the diagnosis of what we call it. The enlarged breast is from a lot of extra skin from the stretching from all that extra breast tissue. The nipple goes lower, the areola are enlarged, and we really want to get you back into a perkier, more proportioned breast, and that usually involves incisions. So through those incisions, I will remove some breast tissue, I will move the nipple back up to where it used to be, and remove that extra breast skin to give you a perkier result. Now, those incisions can be modified. I say that uniformly for a breast reduction, the most common incision that I will use is an inverted T, so it looks like an anchor. Almost always those scars heal inconspicuously and do not look raised or red or stretched, and really heal like a fine line. That takes time though. That can take up to a year, so you have to be patient. There are some patients that I can do fewer incisions. Generally that incision along the breast fold at the bottom can be reduced, but usually I would have some kind of donut incision where there's a T attached to that with very little along the fold, so it looks more like a circle with a straight line. That incision also will heal beautifully over time. The best way to understand about why I need to make those incisions, what the scars will look like, and what we can predict in the future is come in for consultation. Just because you're having those incisions doesn't mean they're going to heal poorly. There are many things that we can do to help those scars move along and make them so they look inconspicuous. We can use laser therapy on there, we can do some steroid injections, or we can use some topical silicone gel sheeting, which is a very common thing that I do in my surgery and postoperatively. So the best way to find out what is involved with a breast reduction, what kind of incisions I'd have to use, and why I want to use them, I think across the board in my population, patient population, and really in plastic surgery practices, people want a great shape, and if we can get those scars to heal inconspicuously, that's a win-win for everybody. I think when you make a trade-off for less incisions, for a poorer shape, I don't think that's a great situation. So I want to get you back into a really pretty, perky, proportioned breast that heals beautifully, that makes you feel proud that you've had this done. So come in for consultation. We'll talk about what options are available for you. We'll talk about what scars could be and the treatment afterwards. Thank you very much.